Hello, welcome to Ask a Pharmacist Corner. This is Marcy again. Thank you very much for watching my videos. I appreciate all the comments everybody is giving me, and please give more comments. Please subscribe to my video, and so that I can continue this. Every week tell you about something that's important. So this week's subject is about athlete food. Athlete food is a fungus of the foot or itchy foot. So every week I have a customer that asks me about, shows me their feet, and they want to know why their feet is itching, is red. So they want to know about it. So I decided to do one video on this so we can talk a little bit about it. There's not much to go on because it's very simple. The athlete feet is basically fungus of the skin, and it can happen mostly if you're barefooted, if the ground walk on is contaminated, and the bacteria can get into the skin and cause fungus. It can happen because of extra moisture in between the toes, and that also can cause the fungus. Or at the gym, if you're barefooted, also fungus can grow like that from the gym. Or if somebody has athlete foot and you touch the area, it can spread it. So the athlete foot symptoms are itchiness. It can be redness, inflammation of the skin. It mostly happens on in between the toes. It can be a scaliness of the skin. The skin becomes scaly if it gets really bad. The redness and crackiness of the skin, so you can crack the skin, and flakiness also can happen with it. If it's not taken care of, it becomes really scaly. So the thing that bothers most people is the itchiness, and it itches really, really bad. So that's when they can come to the pharmacy. Athlete foot can be taken care of if you catch it at the beginning. But if it goes too far and becomes scaly and too red and inflamed, then you have to go see a doctor. So make sure that you catch it quickly. Go to the pharmacist. The pharmacist can also always help with the advices and over-the-counter medications. Actually, let me just first talk about prevention, how to prevent. The best thing to do is make sure the fungus can come from the shoes also. So because the inside of the shoe can keep the moisture, especially if you wear tight shoes and all day long. So the tight shoes and the air doesn't get around it in the shoes and can cause fungus, and becomes very smelly and odory. So that would be one other way that you can get fungus from the shoes. So make sure that you always alternate your shoes to prevent the fungus. Alternate it. Don't wear it every day. Air it out. Use the spray to get the odor out and the fungus out. The over-the-counter sprays that are available for that, which are antifungal. And also make sure you always wash your feet at least twice a day or once to twice a day, and dry it really good, because if you don't dry in between the toes, the fungus can grow. So make sure you dry your feet truly. And socks are important too. The socks, in the old days, cotton would help, but now the 100% cotton is not good. The socks that have acrylic in it or polyester, they're called synthetic socks. The synthetic socks are better because they keep the moisture out. All cotton can keep the moisture in. And if you have your feet sweat a lot, if you have a sweaty feet, it can grow fungus. So get synthetic socks, change your socks every day, because it's really, it actually, if you wear a long day, like me, that I wear long day socks and shoes all day long, I'm wearing it. So you can get that more often. So make sure your shoes are not really tight either, because that can also do it. So medications, the home remedy medications, or home remedy to use, things to use is vinegar and water soak, or you can also use baking soda and water soak. What I really like is what I recommend to my customers, and that's over-the-counter medication, and my favorites. So something that I know more about than home remedies. So one of them is, so we want to use antifungal creams, and the antifungal creams, something like miconazole 2%, clotrimazole 1%. They come in a spray and the powder form. The Z-Sorb, which is also miconazole 2%, is really good. So all of these are good, but they come as a cream. Lamisil is another cream that used to be prescription, and a few years ago it went over the counter. It's actually a very good cream to use, or terbinafine. So all the over-the-counter medication, creams and powders that are available are very good to use. My favorite is actually like clotrimazole or miconazole 2%, the clotrimazole 1%. What I do recommend, if your feet is very itchy and red and is inflamed, use the antifungal cream along with hydrocortisone cream 1%, because the hydrocortisone cream 1% reduces the inflammation and reduces the redness, and with the antifungal cream you can get rid of the fungus more quickly, because it gets rid of the itchiness and the redness. So antifungal cream along with hydrocortisone cream, if your feet is inflamed and flaky and red, it's very helpful. What my suggestion is, always the fungus sits under the skin also. So once the fungus goes away, once the atrophy goes away, apply the antifungal cream for 2 to 3 more days, so that you can get rid of the fungus under the skin. So that way it doesn't come back. But make sure you always wash your feet thoroughly and dry it, because that would actually prevent it. So thank you very much for listening. Please go to my video, to my YouTube Ask a Pharmacist Corner, and watch my video, and always subscribe and give your comments. I've been doing this at the pharmacy for 24 years. So any question you have, please, I enjoy consulting and I enjoy telling you about it. Thank you very much, and have a good day. Thank you.